Aveeno Anti-Itch 1% to 3% Lotion Topical Local Anesthetics contains Pramoxine, which is used to temporarily relieve itching and pain caused by minor skin irritation such as minor burns, cuts, scrapes, sunburn, eczema, insect bites, cold sores, or rashes from poison ivy, poison oak, or poison sumac. It can also be used to temporarily relieve the itching and discomfort from hemorrhoids and certain other problems of the genital/anal area, such as anal fissures and itching around the vagina/rectum. Pramoxine belongs to a class of drugs known as local anesthetics, and it works by numbing the skin to block the feelings of pain and itching. This product may also contain other ingredients including skin protectants, such as calamine, zinc acetate, and zinc oxide. It is important to read the product package carefully before using this product to make sure it is right for you. Do not use Pramoxine for skin irritation in children younger than 2 years or for hemorrhoids or other genital/anal conditions in children younger than 12 years unless directed by a doctor. When using this Aveeno Anti-Itch lotion, make sure to only apply it to the affected skin as directed. Avoid using it on severely broken skin or open wounds. If you're using it for skin irritation, you can apply it up to 3 to 4 times a day, as directed by your doctor. For hemorrhoids or other anal conditions, you can apply the medication after each bowel movement or up to 4 to 5 times a day. Make sure to wash your hands after applying the lotion, unless you're treating your hands. Avoid using the lotion on large areas of the body or more often than directed. Do not cover the area with waterproof bandages or apply heat without your doctor's approval. Also, make sure to avoid getting the product in your eyes, nose, ears, or mouth. If your condition worsens or doesn't improve after 7 days of treatment, consult your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience burning or stinging after applying this lotion, it's important to let your doctor or pharmacist know. However, most people using this product do not have serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. In the US, if you experience any side effects, you can report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, if you experience any side effects, you can report them to Health Canada at 1-866-234-2345. Before using Aveeno Anti-Itch 1% to 3% Lotion Topical Local Anesthetics, make sure to inform your doctor or pharmacist if you are allergic to Pramoxine or any of the other ingredients in the product. This is important as the product may contain inactive ingredients that can cause allergic reactions or other problems. Also, remember to inform your doctor or pharmacist about your medical history, especially if you have deep, open, or puncture wounds, broken, damaged, or blistered skin, animal bites, or serious burns. If you are using this product for hemorrhoids and you experience bleeding from the rectum, stop using it and consult your doctor immediately. Before undergoing surgery, remember to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown whether this drug passes into breast milk. It's important to be aware of potential drug interactions when using Aveeno Anti-Itch 1% to 3% Lotion Topical Local Anesthetics, as they may change how your other medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If this lotion is swallowed, it can be harmful. If someone has overdosed and experiences severe symptoms like passing out or difficulty breathing, it's important to call for emergency help. In the US, you can reach out to your local poison control center at 1-800-222-1222, while in Canada, residents can contact a provincial poison control center for assistance. Always keep this lotion out of reach of children to prevent accidental ingestion. Remember to use it only as directed by your healthcare provider. Be sure to follow any dietary regulations recommended by your doctor or pharmacist. Do not use this medication more often, apply more of it, or use it for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Do not use this product for longer than 1 week unless directed by your doctor. Do not cover the area with plastic or waterproof bandages. Do not use this product, especially the foaming form, near an open flame. Narration: it's important to attend all medical and lab appointments as recommended. Follow any dietary regulations advised by your doctor or pharmacist. Do not use this medication more often, apply more of it, or use it for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Do not use this product for longer than 1 week unless directed by your doctor. Avoid covering the area with plastic or waterproof bandages, and do not use the foaming form near an open flame. If you are using Aveeno Anti-Itch lotion on a regular schedule and miss a dose, use it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Use your next dose at the regular time. Do not double the dose to catch up. It is important to use this medication as directed by your doctor to get the most benefit from it. Make sure to store Aveeno Anti-Itch 1% to 3% Lotion Topical Local Anesthetics at room temperature. Always check the product package for specific storage instructions, or ask your pharmacist for guidance. Keep all medications out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When this product expires or is no longer needed, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.